When we're working with babies, we want to use that same tried and tested formula that we do with adults. And that is, we take the history, we then do the examination, we do the treatment, we have post-treatment advice, and we cycle through that. However, when we're working with adults, adults are happy to lie there and go through that process, whereas with babies, often they aren't. And so it's really key to have transitions, this ability to change things up, go from history into examination, go maybe a little bit into treatment, back into history, and cycle through that. It's important to do that with adults as well, but even more so with babies because they're a tougher crowd. Often what you'll find is that they won't just lie there. And so we have that transitions, but we also have to be able to use different positions, moving them from supine to prone and all sorts of things like that. And so it's really key, the kind of philosophy behind working with babies that really works well is that you have these three following things in mind. The first one is, if it's not broken, don't try and fix it. I.e., if things are going well, then you don't need to change it. If baby is lying there on the bench quite happy, then just leave them lying on their bench quite happy while mum's there at one end, you're at the other, and you're starting to work with baby. Go through the examination, go through the treatment. However, if baby isn't doing well, point number two, if things aren't going as well as you like, then you do need to change it up and you do need to go through these transitions and you need to go and move into a different kind of position, which is going to at least get baby a change. Even if they're not happy with that, at least things are going to change and you have the potential for things getting better in terms of the treatment. So number one, if it's not broken, don't fix it, stay with what you're going. Number two, if it's not going as well as you want, then yes, you change. And number three is working out the difference when baby is about to crack it. So what I mean by that is things seem to be going well, you're in phase one, things are going well, baby's lying there, and picking up on the subtle signals that baby is moving into that thing where they're not going to be happy, and then you're going to go into that phase two, which is to change things up. So one, recognize when it works, don't change it. Two, recognize when it's not working and change it. Three, recognize when baby is moving from that phase one to phase two of it not working and get in early and make the change. Now, to add to that, what I just want to say is have confidence in yourself. Have confidence in that the process of transitions is going to make things better. And so what you'll see here with this footage is that when I transition baby, they're not particularly happy with what's going on. So what happens then? And then I transition them again into the next phase. And you just go rolling through your transitions, and there's 8 or 9 different transitions between supine, prone, sideline, feeding, over your shoulder, on your knee, lots of different ones to use. You just keep rolling through them until you get to a stage where baby is happy. And if you don't get to that stage, well, you've gone through the whole treatment already because you've gone through a couple of cycles of these transitions. And that's fine. If baby wasn't happy through the whole thing, sometimes that happens, but you have made the best of the bad job and done as much as you can with that baby on that particular day. And you come back and you do it next day and you try again the next time, and hopefully baby will be more conducive to treatment in that particular time. So 2 key learning points from this video. The first one is work on your ability to tell when baby is doing well and when they're starting to move into that phase when they're not doing well, and then you can change things up. The second key learning thing is work on your transitions. Work on your ability to have different positions to fall back on and to change things up so that you can really allow that treatment not to escape from you, and that you can get baby on side with you and in a position or in a way that they're going to be able to cope with the treatment that you're going to give them. If you like this video, then check out the playlist here on other material on treating babies. Or if it's more adults, that's your thing, then there's also a playlist here on case studies and other articles in terms of how to treat adults.